NAD plus is one of the most important coenzymes or factors in our body. As we age, the levels of NAD plus we have go down. As we age, more of our NAD plus is needed to repair the body. As we age, we get more cellular damage, less cellular efficiency, and more repair that's needed for our bodies to fix itself. NAD plus is one of the key molecules that's involved in every one of these pathways. When you take NAD plus, you can take it orally or IV. So you may be wondering, why do I want to take it IV? The reason is because when you take it orally, it doesn't really make it into your body. Well, what does that mean? Well, there's something called first pass metabolism. First pass metabolism is when your intestinal tract destroys stuff and it doesn't make it into your bloodstream. Now, our intestinal tract, our stomach, small, large intestine, are set up to process food and to keep bad things out. Good things in, bad things out. The way we as humans have developed is our body breaks food down into vitamins and then takes those vitamins and nutrients in. It's not designed to take in vitamins in their pure form. NAD plus, when you take it orally, makes it very insignificantly into your bloodstream. So the way you bypass that is you do an IV infusion. By doing an IV infusion or putting it straight into the bloodstream, you don't have first pass metabolism, or you don't get that breakdown by your intestinal tract. The first pass is done to keep bad things out and destroys things like bacteria and things you don't want inside you. When you do the IV infusion, we recommend either 250 or 500 milligrams. The 250 milligram dose is a dose that can help with sleep, energy metabolism, mood stability, cellular repair, your body's ability to heal, recover, and function. The higher dose is 500 milligrams. Now, the 500 milligrams is thought to have more of an effect in neurocognition. Our nervous system, our brain, all the nerves in our body are dependent on NAD plus to do their function, and they're more dependent on NAD plus to help with repair. So when you take the higher dose, more of it makes it into your nervous system, into your brain, into your spinal cord, into your nerves, so you get more repair, more function. Think of your body as a factory. When you first arrive, right, you have all the tools and everything is new and everything is working, right? Think of an engine like a cell in your body, an engine in a factory, a machine. That machine initially is going to be well lubed, it's going to work well, and it's going to make or do whatever it's supposed to. Now, imagine that same engine running constantly after 5-10 years. Parts break, it doesn't work as efficiently because things get worn. And you need things to repair that machine. Now, NAD plus is one of the factors in our body that it uses to repair itself and to function. So you're getting older, your machines, your factory needs more tools to help itself, but the stockpile of NAD plus in your body is getting less and less because more of it is being consumed in repair, and there's less available for function. So it's a double whammy. You have less and more of it is being consumed. So by giving it IV, you're helping peak performance, you're helping cognition, you're helping mood stability, you're helping function. The medicine isn't something a big pharmaceutical company can patent and put a hefty price tag on. Because it's a medicine that's steadily available, and there's many studies that show some potential benefit, it hasn't been studied as widely as things that are available. NAD plus infusion is available at our clinic in two options. Either you do 250 milligrams once a month, or you do 500 milligrams. It's a monthly program that you can start and you can cancel it at any time. But most of our people love continuing doing it because they feel better, they function better, and they live better. The biggest evolution and change that I've seen in medicine over my past almost 10 years of practice is medicine isn't just about helping people who are sick. Medicine is about helping people now be at their peak level. Medicine now is about stopping people from getting sick. And medicine now is about helping people be at their very best. The NAD is given via an IV infusion. It takes an hour or longer to finish the infusion. The reason you can't push the medicine in fast is if you put it in too fast, the patient can get nauseous. So when you come to the clinic, we'll have you seated in a comfortable medical chair. We will then check for veins. So we'll look at what's called the antecubital fossa, or on the other side of the elbow, for veins. You can see she has a nice vein over here, another one there. We'll check the other arm. And here we can see a nice, thick, robust vein right over here. So we'll put a tourniquet on and we'll check for veins more clearly, but we can see we have some good candidates. Now, if we're unable to find a vein, we have other tools and technologies to help find it with more precise tools. But usually, finding it this way is the easiest and least invasive. So we'll start with an examination, a visual one, and then a palpation one that we've done. We'll verify that with the tourniquet next, and we'll show you how we do that. So we give the patient a squeezy ball. Here, she selected to squeeze an implant, so we gave her one. And we pick the left arm as the one that has the best veins. So we'll gently put on a tourniquet now to put our IV in. So that's our step one of our placement. We have to make it a little bit tight to make sure it's nice and snug to get the good vein. Once our tourniquet is in, we have to find the best vein. Now we'll have her squeeze the squeezy ball, or implant in her case, and we'll find the best vein that is the most easy to feel and see. There's a great one right here. So we'll go for the vein that's the most prominent. Can you squeeze for me a few more times? The next step is we're using an alcohol pad to clean the skin. And this even helps us see the vein a little better. Perfect. Now we'll open our catheter. We use special catheters that prevent backflow. So we'll open that. This catheter has a one-way valve to protect the patient and keep things nice and clean. When you open the catheter, what you see is there's a little metal needle there with a button to pull the needle back and just to have the plastic catheter. The needle is there to penetrate the skin, get into the vein. Then what you do is you advance the catheter. You feel it? We'll poke on 3. 1, 2, 3. A little flash, advance. And we'll disengage. Now we'll gently pull this out. Now we'll go ahead and connect our catheter to our fluid and make sure we have good flow. And you can see we have nice flow. There's no infiltration, and once we confirm good flow, we'll go ahead and put a single tegaderm to protect it. We want to put a single tegaderm or bandage over. We don't want to over bandage the skin because it hurts and it's uncomfortable. So we put one protecting the catheter and the vein while making sure the tubing is nice and straight. Gentle pressure. Now we'll take the tegaderm off. And that's it. So our medicine is flowing through. We have a 500 cc bag of saline with the NAD+. Our patient today is doing 250 milligram infusion. We run it at about 1 drop a second, and it goes straight into the arm. This will be here. If the patient needs to take a bathroom break or go anywhere, we can always pull the bag off, or they can take the pole with them. The key thing we want to make sure is the patient doesn't get nauseous during the infusion. If they do, we slow down the rate of infusion and or give a little bit of medicine to take away the nausea. So we're always checking on the patient to make sure they're feeling well and they're doing okay. During the treatment, the patient has a call button they can push to reach us. We also check in on them and we're monitoring them during the infusion. How are you feeling? Any nausea? Awesome.